I now recognize the gentleman from Michigan, Mr. Walberg, for 5 minutes.
Thank you, Mr. Chairman. General, thank you for your service. Probably the number one question or concern phone call I've been getting on this issue in the past several weeks comes from family members of our military, whether it be active National Guard, Reserve troops, a concern that what they've seen go on in places where they expect their family members to potentially have a death sentence as a result of being proud members of the military and signing on for that and committed to their efforts. Yet there are concerns that the way it's carried out at times, their loved ones haven't been given the necessary tools, armaments, rules of engagement, and all the rest to handle what they've been trained to do. That's a concern for them. But the biggest concern that they're conveying to me on those phone calls or meetings in public is that this is a potential death sentence being sent in to combat a virus, and with great uncertainty because of the multitude of changes in protocol, at least perceived by them, coming from what they hear in the news, hearing from leaders in this administration with responsibilities, and also the lack of information coming from the military on what they're doing. Let me ask if you would just briefly walk us through a daily routine of one of the soldiers that has been sent over to West Africa.
Congressman, thank you for the question. I've spoken to the commander on the ground, and I've talked to the folks at AFRICOM, and this question comes up quite a bit, actually. The protocols for an individual on the ground for your average soldier, and again, I would like to emphasize first, none of the military personnel will be providing direct patient care. We have 4 lines of effort: command and control, logistics, engineering, and training. So the protocols for treating patients is not something that individual soldiers will be doing.
But they do come in contact with contractors, with aid?
Absolutely. And so the protocols in place over there, as Mr. Lumpkinson can testify to since he's recently returned, there's a no-touch policy over there. There's a 3-feet separation when you're talking to local nationals over there. And that's being enforced both on the Liberian and the U.S. military side quite strictly. In your average day for a soldier over there would be obviously getting up, eating chow, doing the usual morning routine, get your temperature taken first thing in the morning, and then go out to whatever task you are going to do. Again, if you're in the command center, that involves going from your billeting directly over to the command center and sitting in a computer terminal or working on the generators or whatever it is that you're doing inside the command center. It involves eating only food from approved sources, drinking mostly bottled water or exclusively bottled water, and washing your hands in chlorine solution virtually everywhere you go. You go through your day. At the end of the day, every time you come back in the compound, at the end of the day, wherever you're living, you get your temperature taken again, more chlorine wash, in order to ensure that you stay Ebola-free.
Will the U.S. military personnel have ZMapp or any other experimental drugs available to them on the ground in Liberia?
There will not be any. I will have to take that for the record. I'm not aware that there will be any ZMapp available on the ground. The personal protective equipment will be issued to them depending on their level of expected exposure. For the vast majority of people, that will include surgical gloves, overgloves, boots, and a Tyvek suit. Obviously, for the medical personnel, it will be more along the lines that we've talked about here for the healthcare providers.
Dr. Lurie, in 2005, the Bush administration proposed a rule change that would allow the CDC broad powers to confine individuals that are believed to be infected with deadly pathogen like the pandemic flu. President Obama withdrew this rule in 2010. Do you believe the CDC needs or should have this authority to ensure an infectious disease outbreak like Ebola is contained and controlled?
Thank you for that question. I think with every situation, we're always reviewing and taking a look at whether we have all the authorities we need to do the job. In our system of government right now, that authority rests with the states, and they have authority to do that when they think it's necessary.
But the CDC shouldn't have that authority that they did have, and it could be flexible. There was certainly authorization. They didn't have to. Don't you think that would be a valuable authority to have?
So what I would say is I think that we are always learning and adjusting based on our experience, and that's one of the things I think we'll probably be looking at as we move forward.
Well, I hope so. We're sure learning right now. I'm not sure we're adjusting as rapidly as possible, and I'm certain we're not giving any type of security to our medical workers, nurses, including our citizens out there, that we have a solid policy in place that is first and foremost protecting our citizens against these type of problems. And I think it's evident by the hearing today and hearings that will go on that you're not bringing us a sense of security. And as a member of Congress representing a district, I'm expressing that point of view from my citizens who believe that we are less secure than we ought to be if we'd used the policies that had been put into place. Mr. Chairman, I yield back.